I want to welcome everybody. My name is Jeff Holmgren. I work with the Burnaby Primary Care Networks. I'm sorry, I'll put my video on so you can see me just a little bit. The Burnaby Primary Care Networks, this is one of a series of talks that the Primary Care Networks has been putting on. Today we're focusing on brain health for seniors, and this is always an important conversation, but we know that in the time of COVID, as we go through the pandemic, the impacts on our brain health for all of us are extremely high. The level of stress that we're all under and the anxiety that we sometimes feel is extremely high. And for seniors in particular, many of whom are quite isolated, it seems as if it's much greater. We're fortunate to have with us today Dr. Davidicus Wong, and I'll talk a little bit about Dr. Wong in a moment, who will speak to you around the conversation. I do want to say that we are recording this conversation. Also, there's an opportunity to put questions forward in the Q&A. We can't guarantee that we'll get to all of the questions today because, as I say, it's a fulsome presentation, but we'll take the questions, and when we put out a report, which is a copy of this presentation, to the attendees, we'll do our very best to answer all of the questions within that. Also, this recorded presentation will be posted on the website, www.burnabykoronavirus.com. So if you want to share it with your friends or your family, it will be there. They can go and see it there. There are a variety of links that are included within the presentation, and you can also find them there. So don't feel as if you have to write them all down. We will email it to you, and you'll also be able to access it on the website. We do have a couple of translators working with us today, Debbie Ho and Amy Lin, and they'll be working in a room which is actually a room where there will be a Chinese room where there will be translation to Mandarin. If you take a look at if you're looking for that room, and if you take a look at the screen, it will tell you how to get there. Essentially, what you do is you go to the bottom part of the screen where it says interpretation, and if you click on interpretation, and then you click mute original audio, click on Chinese, and then click mute original audio, you will be in that room and you'll hear the translation from Debbie and Amy. And Debbie, if you'd like to explain that in Chinese, that would be wonderful.
OK， 大家好我是 Debbie from ISS of BC。那今天这个讲座是会有中文频道的，请你呢在下面你的那个window 就是那个视窗的下面呢，你会见到一个地球的东西，按下去，你会看到有个中字，有 Chinese， 按下去，然后呢，你再选 mute original audio， 然后呢，你就可以听到中文的频道了。谢谢 ，Thank you. Yeah, I've translated.
That's great, thank you. And if folks have issues at all and they can put them in the Q&A, we'll try to make sure somebody can come along and to help you with that. So I did want to briefly introduce Dr. Davidicus Wong. I think many of you will know Dr. Wong from his columns that appear regularly in the Burnaby Now and also in the Vancouver Courier, or also just simply because of his presence as a family doctor in Burnaby. He works at the Prime Care Medical Center. He's lived in Burnaby since his childhood and went to UBC. Dr. Wong was also the inaugural board chair of the Burnaby Division of Family Practice, and then became the physician lead in 2013, and he continues to work very closely with the division in all of its initiatives. So his list of accomplishments is long, but I want to be able to give him plenty of opportunity to speak to the topic. So without further ado, Dr. Wong, I'll turn it over to you.
Well, thank you, Jeff. I'll just take off my PPE. I was just wearing a little Halloween costume for the kids coming in for their flu shots. And I'm gonna switch over to my microphone so you can hear me a bit better. So welcome. Today's health. I'm just gonna put up my slides. And can everyone hear me okay? Are you able to see the slides, Manny? Is it share screen now?
You should be able to share the screen and show your slides.
Okay. Okay, can you see that nice and clear?
Yes, we can.
This is just looking forward to spring. This is taken outside of Bonser, one of our great community centers. Okay, and just a friendly reminder, this is the time of the pandemic, and I know right now we're practicing excellent social distancing, but we can't let our guard down, especially with this second wave. So when you're out and about and around other people outside of the home, I do recommend that you do wear a mask covering your nose and mouth, because there are times where we're getting a little bit too close to one another, especially in a lot of our events where we are able to get together. We still have to maintain that 2-meter distance, wear a mask if we're any closer, and really careful hand washing and hand hygiene, because we know that the virus spreads through respiratory droplets that kind of spray out when we're talking. But if we keep a good distance or wear the mask, we can protect one another and protect ourselves as well. So just a reminder to keep ourselves safe and one another, especially the most vulnerable in our communities. So thanks for being safe and keeping us all safe. The Burnaby Division of Family Practice also hosts the Empowering Patients program. So it had been in-person talks that I've been giving, about 6 talks per year in a variety of helpful topics for your well-being. I just want to make sure that everyone can see the slides. Can you see the slides okay? Good.
Yeah.
So one of the foundations concepts is real healthcare is self-care. So the majority of things that keep you healthy are the things that you do for yourself. And our job as healthcare providers, doctors and nurses in allied healthcare, is to support you in that process, to give you information that you need, to give you the resources that you need. And the primary care network has been an excellent way of helping to bring all the resources in our community to support you in your goals. But part of self-care is that to look after the 4 foundations of looking after ourselves. And those include, let me just advance this. What you eat, what you do, how you feel, and how you relate. Really, that means healthy nutrition, healthy eating, healthy physical activity, including exercise and everyday activities we do all the time, emotional well-being, and healthy relationships. So I'll be addressing this because these are so essential to brain health as well. Because pretty well what's good for the body is good for the brain. So the big question we all get when we're over 50, like myself, is, am I getting dementia? So how can you tell if it's normal aging, normal forgetfulness, or if it's something I should be concerned about, something that's more serious? Well, we all know with normal aging, we get a little bit slower in recalling things. So it might be just on the tip of our tongue, but it eventually comes out. We could be a little bit absent-minded, like coming into a room and forgetting what we were doing because we were thinking about something else. And a little bit decrease in short-term memory. So we're not that quick in reading a book and be able to recite all the facts right away. So a slow, gradual decline in these things are quite normal, but there are things we can do to slow it down as well and to actually improve things as we get older too. Because the old model of the brain, you probably heard in school like I did, is that we have all these neurons when we're born. They keep on multiplying. We're at our peak when we're about 19 or 20, and then after that, it's all downhill. Well, that's not really true. The brain doesn't necessarily degenerate with age. We do know statistically that our speed of cognition, speed of thinking, information processing peaks around age 18. That short-term memory peaks around the mid-20s, starts to go down in our mid-30s when we get a little bit absent-minded and forgetful. The ability to read another person's emotions, however, peaks when we're in our 40s and 50s, and vocabulary kind of peaks in our late 60s and 70s in general. But it doesn't mean that you can always make other improvements at different times. That's why at your age now, you do things much better than you did in the past. And certainly we all have a lot more wisdom than we did when we were 18 or 20. It's really important to adopt what we call a growth mindset towards our own health and our mental and physical well-being, as opposed to a fixed mindset, thinking that I'm not good at math, I'm not good with names, or I'm just getting older and this is the way it has to be. A growth mindset reminds us that we're always evolving and growing growing in experience and also growing in our abilities. And the brain, just like the body, gets stronger and adapts the more we challenge it in a positive way. So adopt that growth mindset and don't pigeonhole yourself in thinking that you cannot continue to improve in age and with the passage of time in a healthy way. So it could be a possible problem with your thinking or cognition if you're getting some of these things, or if they're coming on quite suddenly and getting a lot worse. So one is brain fog, like difficulty focusing on conversation, feeling kind of foggy-headed, and difficulty concentrating on a TV show or what you're reading. Losing things is pretty normal, but when people are suffering from dementia, one of the early signs is they're losing things, but they're thinking that someone is stealing their things and they're blaming other people. Of course, if you're married, you probably blame your spouse all the time, and that happened when you're in your 20s and 30s as well. But I had patients that came to me and said, someone's stolen all the stuff from the safety deposit box. I went there and it was all gone. And there was a lot of back and forth till we actually realized that it was the patient's memory that we needed to address. If you start forgetting to do routine tasks that you used to do really, really well, like cooking, operating your appliances, like being able to do the laundry. Some people never learned how to program the VCR, which is fine because we don't have VCRs anymore, but now you have other things, other technology. So don't feel bad if you can't program your latest iPhone. But if it's things that you routinely do, like folding up the laundry, putting things in the right place at home, if you're having big lapses in abilities to do things that you once did really, really well at home, then that's something to seek some attention with your physician. Or if you're getting lost. So it's pretty normal if you go to a Metrotown mall and forgot where you parked your car. It's not normal if you actually took the bus there and you're still searching for your car for half an hour and you haven't driven for 10 years. And it's normal to get lost in an unfamiliar place, but it's not so normal to be lost in your own home and your own neighborhood. So getting lost is one of the problem signs that we should be looking out for to make sure there's no underlying condition affecting your memory and your thinking. So here's some clues that you probably should see a healthcare provider to look a little bit more deep. So if your family and friends are really complaining or noticing your forgetfulness more than you do. So with benign normal aging and little decrease in short-term memory, usually it's the individual that notices it, that's a little bit more forgetful. And when it's something significant like Alzheimer's dementia, often the individual may not be totally aware of things, and it's actually family members that notice the big things and bring that to my attention. If you're getting lost and you're getting confused or disoriented, or if there's big lapses of time of which you have no recollection, or forgetting the names of common objects like a pen or a watch, and you're really searching to find a word for that. So forgetting your normal vocabulary, that's an indication that we should seek to make sure there's no medical cause that we should be investigating and treating. So I'm trying to leave some pauses so that our translators have a chance to translate this information. So what to do? So if you do have concerns about memory, if you think it's a little bit more than you should be expecting, or if you have any doubt, don't hesitate to see your family doctor. So what I would do is review medications just to make sure none of the medications you're taking over the counter or prescription could be contributing to that. There's some common medications like sleeping pills often decrease our memory, increase the risk for being forgetful or even for dementia. That's why we don't encourage that to help you sleep anymore. We encourage more natural ways of sleeping, and I'll give you some tips later on in the presentation. We'd also look at some drugs that we're using for other purposes. So a lot of the drugs that we use for managing incontinence or bladder or prostate problems, they often have what we call anticholinergic effects that can affect our memory as well. And when we alter those medications or substitute them, people often do much better. And we'll also ensure that there aren't any health conditions that can be contributing. So as I mentioned, what's good for the brain is good for the body. So we'll talk about management of chronic health conditions like a thyroid condition can also affect your memory. So a healthy brain does require good circulation. We sometimes kind of think that the brain operates totally separately from the rest of the body, but the brain consumes most of the calories and energy that we're doing. So it's the one that's really preserved, our heart and our brain. So we require good circulation to provide oxygen and nutrition just for our brain to function normally. So anything that can damage the arteries, as with the heart or in the peripheral vascular system, circulation to our hands or toes, can damage the brain over time. So we do need to pay attention to high blood pressure. If you smoke, you definitely should quit. We want to manage our cholesterol to make sure it's not too high. And if you have diabetes, to manage the blood sugars well, because these conditions can contribute to poor circulation of the brain and predispose us to premature dementia. And of course, with your physician, we'll check for other causes that can affect your memory. If your blood count is really low, like if you're deficient in iron, you might have an anemia, and that could affect your energy, your mood, as well as your thinking and alertness. Again, as I mentioned, side effects of medications, either over the counter, like antihistamines, or sedatives that people take over the counter to help them sleep, those can also affect your thinking and your memory. If you have an underactive thyroid, which is a gland that controls our energy level, it's located in the front of the throat. Commonly, it becomes less active as you get older. And some people have what we call clinical hypothyroidism, that they're slowed down and tired and gaining weight. And that's easy to check with a blood test. Depression is a common cause for problems with memory. In fact, our nickname for depression is pseudodementia. Someone doesn't actually have dementia, but their focus and concentration is slowed down, and it can act as if they do have premature memory loss. If we're really stressed, really anxious, that can affect our thinking quality as well. And of course, if you have a stroke or some other brain disorder, that would affect our cognition, thinking. What we would do if you have concerns, or if we have concerns about the memory, is doing what we call the mini mental status exam. So it's actually a pretty straightforward test that checks on your concentration and memory. We'd be asking questions like asking you to tell us what the date is, like the month, the day of the week, and the year. And I'm often surprised when someone is actually in a different century than the calendar year. We'd ask things like the season, and that's difficult in Vancouver because you can look out the window and there's no clue. It's a rainy day. It could be any of the 4 seasons. We'll ask you to memorize 3 objects and then, work on some other tasks, and then ask you to recite those 3 objects. So as a little exercise, we're going to give you 6 words to remember and then help you test your memory on that as well, and to see if you actually improve your memory over the course of the next 30 minutes. And if we do identify a potential problem, we could enlist the support of a neurologist or a geriatrician. So please do see your physician if you have any concerns about your memory or your concentration, or if you have those concerns about one of your loved ones. There are things that we can do to reverse things if it's a preventable condition. And sometimes it's something very simple that we can correct, but regardless, even if it's early Alzheimer's dementia, there are many things we can do to support you and to improve your function and keep you independent. So a little memory exercise. So a little bit harder than a mini mental status exam. I'd like you to remember these 6 words. And remember, this is harder than the exam you'll do with the doctor in the office. So the words are apple, table, penny, dog, ball, car. That's a pretty challenging test, but I'd like you to recite those in your head and try to remember them in the back of your mind. And of course, I'm going to go on with the presentation and distract you. And in a few minutes, I'll ask you, now let's go back to that exercise. Can you remember any of these 6 objects? So if you have a pen or paper, then don't write them down now, but when I ask you, try to recall what any of those 6 objects are. Again, they're apple, table, penny, dog, ball, car. So take a good look at them. I'll wait a moment so you can translate as well. And I'll be asking later about the 6 objects, but don't write them down because that's cheating. So as I mentioned, what's good for the body is good for the brain. Healthy eating, adequate exercise and rest, managing stress, managing the emotions, and healthy relationships, social connections. So nutrition, what we're eating and putting into our body makes a huge difference. So it's been demonstrated that the Mediterranean diet, which is really high in fruits and vegetables, high in the healthy oils like olive oil and fish oils and nuts, and low in processed food and red meat and saturated fats and refined foods. That Mediterranean type diet is much better for brain health as well as for cardiac health as well. We really should limit alcohol because alcohol in no way makes you any smarter. If I don't want to be concentrating on anything or be really attentive, then I might have a drink. But I found that alcohol is not a very good toxin for the body or for the brain. So it definitely affects your judgment whether or not you realize it or not. Caffeine in moderation. Caffeine stimulates the brain, but taking too much coffee or tea or caffeinated beverages can stimulate your heart, raise your blood pressure, and it really makes it hard to sleep if you take it later in the day. So a cup or two of coffee or tea, as long as your doctor approves, is quite appropriate, but excessive coffee drinking can affect your energy level as well as affect your heart and blood pressure too. So this is just a little diagram of what we talked about. So eating a lot of healthy whole grain cereals, less refined foods, eating lots of fruits and vegetables, really focusing on eating a fish at least once a week, or even taking omega-3 supplements. Those are fish oils that can help build up these healthy chemicals in the brain. So these are helping preserve brain function. We should be more careful about more saturated fats with butter, with processed meat, with fried foods and pastries, so limit those. If you do eat them, enjoy them and eat them slowly. That second foundation was healthy physical activity. So it doesn't have to be formal exercise. Going for a good walk every day, dancing around. I know you can't get together with dance groups anymore unless you're really spaced out, but you can do your dance moves at home. Doing video exercise is good. Even doing our housework is really helpful. I really like doing yard work because that's a really good workout for an hour or two. So physical activity, you can get that without doing formal exercise, but aerobic exercise, as we'll see, has great benefits to the brain. So exercise has been proven to improve our memory, the functioning of our brain, like recall and mental speed. It improves mental health, like helping us manage stress, anxiety, and depression. And exercise reduces social anxiety, feeling anxious around other people. It reduces depression, and it also reduces or helps us manage stress better. It does this through really influencing how the brain functions. So exercise is known to help neurogenesis, which is a fancy term for creating new neurons. So, you may have thought that we have all our neurons by the time we're all grown up, 18 or 19, and that it's just we're losing them over time. Well, we know that's not necessarily true. We are creating new neurons, but we have to have adequate nutrition and good circulation, and exercise facilitates that. Exercise helps neuroplasticity. So that's a fancy name for the brain being able to create new connections between the neurons. So when we're learning new tasks, practicing a new language, playing a new instrument, reading books, meeting new people, we're creating new mental pathways, and there's a physical connection between the neurons that you already have. And they become richer and richer as we stimulate the brain over a whole lifetime. So there's benefits with exercise and stimulating the brain and learning new things all throughout the lifetime. And that fancy name is neuroplasticity, but it's the ability for the brain to grow and adapt. And that occurs through your whole lifetime. Exercise also positively influences the neurochemistry. Those are these chemicals called neurotransmitters that help our neurons communicate to one another. So you don't have to remember these names, but there are a number of neurons that are improved by exercise. Dopamine, which is that feel-good neurotransmitter. So it helps us, that's why you get that high after having a good vigorous walk or hike. So it's that runner's high, but it also improves the dopamine levels throughout the day. Norepinephrine is the neurochemical that helps with our energy and helps us to focus. Serotonin is the chemical that helps us feel more relaxed and at ease, and it's really important for a sense of well-being and our motivation. And BDNF is like a fertilizer for the brain to help us develop new connections between the neurons. Exercise also reduces some of the stress hormones like cortisol and adrenaline. So even though we're stressing our body with aerobic exercise, it helps us reduce those stress hormones overall during the rest of the day and during the rest of the week. So we know different exercise has different benefits. So we do know that exercise that helps get the heart rate up, gives you a nice sweat, like going for a vigorous walk or doing some vacuuming at home, that can help the symptoms of depression. That same type of aerobic type activity, including walking and cycling, can improve our memory as well. Yoga is really great for stress and anxiety. Yoga, Tai Chi, and aerobic activity can improve our concentration. And all the cardiovascular exercises where we're working the heart and lungs really helps that circulation, which is so important for providing the nutrients to our brain. So we also need to exercise our brain. So one key is to stay socially active, which has been a real challenge during the pandemic when we're asked to stay home, wear masks, not get together with a big family. But we've learned to connect as you are today, just through the magic of Zoom and the internet and FaceTime and Facebook and our smartphones. So I really applaud you for adapting and using this technology, because it's been a real lifesaver in more ways than none for all of us. As physicians, we're connecting with our patients online or with a telephone as well. So don't hesitate to call up your family and to talk and to converse. It's really important to feel socially connected. Reading is really important. One of the most important exercises for your brain, but that's not just reading the things that just pop up on Facebook. Read actively. So the libraries are still open. You can reserve your books. They've been doing really good precautions at the Burnaby Public Library, and I've been putting books on hold and then going in there, and they have good precautions for safely picking up your books as well. But the key with reading is to read actively. So work hard when you're reading. So anticipate what the author is trying to say or what they're going to say next. Be really curious. Ask questions to yourself while you're reading. Jot down some notes, of course, not in the library book, but notes to yourself, or if it's a book that you own. So the more active and the more senses that you use, the more engaged you'll be. And then test yourself, just like you're studying in college or school. So cover up a page or a paragraph after you've read it, and then try to recite and remember all the things you can remember about what you just read. And then in an hour, kind of review what you just read. What you learned, what your take-home messages are. And then at the end of the day, kind of review what you learned that day. Again, do it a week later and a month later. So this is an old technique that we used in university so that we can remember things long-term. Because if we just cram things, we have it for the short term. But to use more neurons to do more work, then we reinforce those memories. So read actively. Another important thing is to stay mindful and in the present. So often we forget to remember if we lock the door or we'll lose our keys if we're a bit distracted, because most of us are kind of leaning forward when we're walking and doing things. We're thinking about what we're going to do next, and we sometimes automatically do these routine tasks and not pay much attention. So the opposite of that active mind or monkey mind that we naturally have is to be mindful, to know what we're doing when we're doing it, to be aware of thoughts and feelings as they arise. So mindfulness is a great meditative practice, and it helps us increase our focus and our concentration, which also improves with practice and time at any age. So don't rush around when you're doing the important tasks of cooking, leaving the home, locking things up. So when you lock the door or when you're turning off the oven, pay attention and say, I'm locking the door, I'm turning off the oven, so that a moment later you don't have to worry that you forgot to do those things. If you're busy cooking and you get interrupted with a phone call, pause before you answer the call. Pay attention to what you're doing. What am I doing? I'm cooking, I should turn off the element because I might get distracted when we're in the conversation. So what do I need to remember from what I'm doing now? So use that telephone call not to immediately react and get distracted, but pause. What am I doing? What should I be attending to? Turn off the stove, stop what I'm doing, and then attend to the call. So if we use those pauses and to stay centered, you're more likely to remember the important things and get less distracted. And these things that we commonly misplace, we all do this when we're rushing around. It's a really good idea to keep our wallets, our keys, or the purse in the same place in your home every time. Always put your wallet in the same pocket. Always put your keys in the same pocket so you'll know where they are and you'll know when they're not there when you're looking for them. If you're taking more than 2 medications, I think everyone needs to use a blister pack or one of those weekly pill boxes that you can refill every week, because no one can remember reliably, no matter what their age, to take a pill the same time every day. If you just rely on these pill bottles and reading the labels, it's easy to get distracted and forget that you've taken one of the pills. And it's better to have this fail-safe system. So important things like taking medications regularly, either get the blister packs done with a pharmacy, but if you want to be on top of your own medications, a weekly pill box that you fill would be useful because it tells you immediately if you've missed a dose. And challenge your memory. So it's good to write down your shopping list, so still do that, but make an effort to remember that shopping list. So one of the keys is to visualize each item, see it in your mind's eye, maybe even taste it in your mind's tongue as well. Use the power of association. So the more areas of your brain that you're using and connecting with, the more likely you're going to be able to pull up that item. Try to connect the items together with kind of striking visual images or sensations, so you're more likely to retrieve them. And you can also use the method of loci, which comes from the ancients, the Greeks and the Romans. So you can mentally walk through the rooms of your home, which you're very familiar with, from the front door, say, to the kitchen or the bedroom, and mentally put each of the items on your shopping list in each of the rooms. So when you go shopping, all you have to do is mentally walk through your home and remember where you put all these items. So the more you do this using really vivid imagery, the more likely you'll be able to recall those items. Still bring your shopping list so you don't get into trouble for forgetting the milk. But if you challenge your memory and work with it through the way that mental exercise works by creating new connections between neurons, you're more likely to retrieve these things. And you'll be amazed how much better your memory is. So time for the little memory exercise. So hope you didn't write down the words, but right now, see how many of those 6 objects you remembered. So it's been a few minutes and I've given you a lot of distractions, but take a moment to see if you can recall 1, 2, 3, or maybe all 6 of those objects. So just do it on your own. You don't have to tell me the answer, but just make a note of how many of the objects you remember. So I give you another moment, another 10 seconds. And then I'll show you the words again. Okay, here they are. It was apple, table, penny, dog, ball, and car. So I'd be surprised if you remembered all 6 of those, because that's pretty challenging. Again, the test the doctor does is only getting you to memorize 3 objects. But let's use the power of association and visualization to see if we can remember these the next time I ask you. So I'd like you to visualize that first word, the apple. And you can imagine a red or green apple, but it's a nice ripe apple and it's just been shined up and it's sitting on the second object on the table. So you have that big red apple sitting on the table, visualize it in your mind as if it's really there, and imagine a rusty copper penny wedged right into the side of the apple and the juice flowing out of that apple. So you got the apple, the table, and the penny. And then imagine a dog hopping up onto the table, having smelled that juice, and lunging at the apple and knocking the apple out the window as if it was a ball, a big red or green ball that bounces on the floor and out the window and hits a car. So you got the apple on the table and the penny. You see the dog going for the apple, bouncing it like a ball out the window and hitting the car. Apple, table, penny, dog, ball, car. So plant those images in the back of your mind. And then at the end of the talk, I'll ask you about the 6 objects, and we'll see how many you remember. So make it as vivid as possible, maybe even taste the apple, maybe even feel that juice all over the table, maybe see that dog or hear it barking, see the ball bouncing out the window, and maybe even hear the car honking its alarm when it gets hit by the ball. So you got that? So important to stay active with your mind and body, but it's also important to rest because the brain needs to rest. Mental activity like active reading takes a lot of energy. So do take some breaks when you're working in front of a computer, when you're watching television or working on the computer. So take breaks every half hour to a couple hours to stretch, to move around, do a little exercise. So the brain needs these little shifts in activity just to stay fresh. Try to maintain a good sleep routine. Avoiding big meals and caffeine and alcohol before you go to bed because they really disturb the sleep. And we really, as I mentioned, should avoid sleeping pills, which actually we quickly get addicted and dependent on them, but they also slow our thinking and impair our memory and actually increases our risk for falling as well. And if you find you're dozing off during the daytime, like you can fall asleep when you're a passenger in the car or you're falling asleep easily on the couch, talk to your doctor. It could be something we should check in your blood, like anemia or the thyroid. But a really common condition is sleep apnea. So that's a condition where it could be at any age, but it's more common as we get older that our airway gets a little bit plugged up, or our tongue falls back and it obstructs part of the airway when we're breathing, and our oxygen levels are quite low during the night during this condition. And then we feel like we wake up having not had enough sleep, and it can make us doze off during the daytime as well. It's very easy to test for. So there's many community labs where we borrow equipment overnight that's carefully cleaned during the pandemic. And it can tell us if you're sleeping normally or if there's a problem with sleep apnea. And it's easily remedied with a variety of treatments. So the importance of sleep and rest. And that next foundation of health is emotional well-being. So managing stress. So it is a stressful time for all of us, but it's important to recognize those things that we need to accept right now, knowing that they will change over time, but also recognize where our choices are and where our abilities are, and to recognizing that you are surrounded by resources. And we'll get more to that when we're talking about social connections. So recognize what you can do. So 80% of the stress is our response to it. 20% is from the condition. So what can we do with that 80%? What are you able to do? So recognizing where we have the ability to make positive changes can sometimes relieve some of that stress. And of course, we have counselors and support and your own physician if you're feeling overwhelmed. Anxiety affects our thinking and cognition as well. And anxiety tends to make us look for all the negatives and all the challenges in our life, and really makes us minimize or de-emphasize the resources and support we have, and it makes us minimize or downplay our own abilities to manage. So when we get caught up in the thoughts that naturally come with anxiety, it can really narrow our focus and affect our thinking. And of course, depression, as we mentioned, is called pseudodementia by physicians because we actually discover that patients do not have dementia, but they're suffering from treatable depression. And when that depression lifts, then their ability to focus and concentrate, their motivation, and even their memory improves. So these could be treated with counseling, with meditation, and in some cases, with certain drugs. But definitely, if you're suffering from unmanageable anxiety or depression, there is certainly lots of help, and we'll share those resources with you as well. As I mentioned, when we're anxious, we kind of overestimate danger, and we underestimate our ability to manage it. And when we're depressed, we think negatively about ourselves, about our situation, and about the future. The fourth foundation of wellness and brain health is healthy relationships. And right now it's a big challenge with social isolation. And when we're alone and stuck in our homes and not connecting with people and our loved ones, we can forget that we're part of a larger network of friends and family and an important part of the community and part of nature. So it's really important to get out, to go for some walks, to meet with friends with good social distancing and face masks. And we can still have wonderful conversations and good times with our loved ones without the risk of passing on infection, as long as we follow those 3 important rules of distancing, face masks, and hand washing. We also have other supports through our community centers. So our community centers have reopened and they're still active and doing their best to reduce the risk for infection. And we have our wonderful PCN Seniors Network that is helping connect us together as well. And to look out for one another, especially neighbors. So it's really important to wave to our neighbors. We could talk a safe distance and just see how they're doing and how we can help one another. So remember, you're part of a greater whole and a really important part of that whole. But sometimes when we are feeling isolated or we're feeling a bit down, we can kind of not see ourselves as part of that bigger, greater self. So here's some important resources. If you or a loved one suspects Alzheimer's disease or having difficulty coping with the diagnosis of dementia, the Alzheimer's Society of BC has wonderful resources and a variety. So check out alzheimer.ca. There's the BC Brain Wellness Program through UBC. They have a lot of helpful resources and lots of brain exercises online as well. So bcbrainwellness.ca, and a lot of the information that I showed you about exercise, those slides come through the bcbrainwellness.ca. And of course, our Burnaby Divisions of Family Practice. This is our nonprofit organization whose members are the doctors of Burnaby. But we're showing that we care not only about our individual patients, but we care about our community. And we're an important partner of our primary care network. And through our primary care network, we do have a mental health counseling program because we have seen the big need for counseling, especially during the pandemic. So you can either call this number that's listed there, or you can check on the website for the divisions as well. So we, Burnaby residents do have access through 6 sessions of counseling through the primary care support network. So you can contact this number or contact your family physician. So these organizations are also helpful. So I think they'll be in the links that come later, so you don't have to write them or memorize them all. Canadian Mental Health Association, Burnaby Mental Health, if someone is suffering from significant depression or anxiety. CAMRE is a good resource for families and for children. And these organizations are also helpful. Anxiety BC, Mood Disorders Association of BC, and SAFER is for those who have had suicidal thoughts or family members whose loved ones are struggling with suicidal thoughts. So a very important hotline to have handy in case anyone you know is having some great difficulties. So our final little memory exercise. Do you remember any of those 6 objects? So I want you to kind of remember those images that we had. And I'm betting that you will at least remember a few more objects than you did the first time we tried this. So give you a few moments to see how many of the 6 objects you remember, remembering all that great imagining and visualization you did. Okay. So here they are again. Apple, table, penny, dog, ball, car, and hope you remember those images. Okay, I'll turn the screen back over to Jeff and Manny.
Great. Thanks, Dave. That was great. As always, just a really a deep and interesting presentation. And I know that there were some questions that came up through the presentation, but many of them you've already answered. But there are a couple that I wanted to pose to you as we have a little bit of time. And one that's really kind of for me. I'm sort of on both sides. I'm moving into worrying about my own memory, and I'm also, my parents are still alive, and I worry about their memory loss, and they have some natural memory loss, and maybe they have some issues. what kind of advice can you give to sort of family and friends as to how to talk to seniors about their memory loss? Because I know that sometimes they can be, well, it's scary, and sometimes they don't want to admit it to themselves or to others, and sometimes they don't want to ask for the help. Is there a way that you think that folks could take this, could address that in a good way?
Yeah, there's probably no one size fits all. By the way, I know I've worked with Jeff and he's still really, really sharp. But one of the greatest things is that you share a lot of wisdom that has been invaluable for the rest of us. So Jeff is a great example of someone that's getting smarter over time, since even during the brief time that I've known you. We all have a lot of fear about losing independence or losing our memory and our cognition. So I think even if your loved one recognizes there's some problems with the memory, often they may want to downplay or even deny it to themselves. But they might be relieved for you bringing up the topic. So I think it's important to address, just like we would talk to someone that has a drinking problem about their drinking problem. So one of the signs that someone does have a drinking problem is they get really mad when we bring it up. But with memory, I think they would welcome it, especially if you let them know that you're doing it for their own benefit, with a sense of their own well-being and not taking away their independence. Maybe actually sharing some of these resources, like these slides or these shows or this information about memory and healthy aging, with your loved one or with your friend or with your partner, so that they know that there's something we can do, that we can see your family doctor, that we can see if there's some things that we can improve or to investigate further. I think they would actually welcome it as some relief that they're getting some help.
That's great, and I think you're right. Just the way that sometimes the way you frame the conversation and that idea of, saying, "Do you want to watch this with me?" and getting some, it might be a great idea for folks. I also you mentioned this the concept, and I know that I do this as I get busier or older or both. I try to make sure that I have some habit, that I work in habit, that I have routine around it. Is that something that we can do? Again, I go back to this as family members, to support our seniors that are having memory issues. Can we support them to ensure that they have structure? Is that a value that we can bring?
Exactly. That's really, really important to maintain healthy routines. So some people have unhealthy routines, like our elderly parents or friends might have, maybe drinking too much or not getting adequate sleep. My dad is 90 and he's really sharp and independent, but he doesn't, hopefully he's not listening. Well, he wouldn't be embarrassed. He stays up really, really late. Like it could be 2 in the morning and he's still awake, and then he can sleep in. But I think it's really important to maintain a normal schedule so that you can be up and about and during the time other people are, so you can maintain your social activity. So I think routines of getting up, eating healthy meals to reinforce that over time. And I think as adult children, for our parents, it's really important that we check up on them, make sure they're having assistance if they need it for these activities, make sure they don't need help getting the groceries, making sure they're eating a healthy breakfast, lunch, and dinner, and not losing some of the healthy habits that they have. And also maintaining that regular physical activity. It doesn't mean having to go to the gym, but just going for a 15 to 30-minute walk once or twice most days of the week would be adequate to get the benefits of exercise. But we can lose that if we fall out of the routines.
Yeah, and I guess it's interesting. I mean, you talk about the time of stress, and one of the things I notice, and my dad and my mom and dad are in their 90s too, is that having that structure and that routine, it actually sometimes gives them something to kind of to look forward to, something to think about in the future, and that gives them a kind of a focus, and it helps their mental health as well as their physical health. It's their memory, but it also seems to support their overall well-being, just to know they're going to go for a walk tomorrow morning, or whatever that may be. So yeah, I can really see that. There was a question here around, you talked a little bit about depression and anxiety, and as you said, I know we're all kind of fending that off these days. And you talked about medication. One of the questions is around, do some medications that you may use to fight depression lead to memory loss, or is that a side effect that people might be seeing? Because I know you said that sometimes depression will affect our memory and our brain health. Can the medication have an impact that way?
Not directly. If they are sedating, so some people might get really sedated or sleepy with a particular medication. Example is one called mirtazapine, which is often used because it helps people sleep, but it can make people so drowsy during the day that they won't be focusing and concentrating. So antidepressant medication won't accelerate memory loss and it won't cause dementia, but to the extent that it makes you too sleepy and less alert, then it can affect your ability to pay attention and remember things.
And I also I want to make I want to build on one of the things you talked around social isolation. And what I've noticed, and maybe you can speak to this, is as people start to feel as if they're losing their memory, there's a tendency to not want to stop engaging, to fear that they may lose their way in a conversation and therefore step away. I know that there's some great programs in Burnaby around that, but is that something that we can encourage our seniors to really be comfortable and kind of be okay with living where they are and take advantage of the supports that are out there?
Yeah, I think that's a very important cultural message to share, is that it's okay to be forgetful and that we're not going to judge you or judge each other when we are a little bit forgetful. We can get a lot of social anxiety about forgetting someone's name or forgetting the names of things. But if we kind of make light of it, but also take it seriously if the individual is taking it seriously, and to show them that they're still loved unconditionally just the way they are, and to know that we're giving them all the support that they would need. I think that welcoming attitude, the non-judgmental attitude, is good. If we're being a little bit critical and then criticizing and picking up every time they forget something, or rushing our loved ones when they're trying to remember something, then that's not the type of approach that would welcome them to engage and to share their vulnerability.
Yeah, and it's interesting. I think about we've had someone working with our working groups, Dorothy LeClaire, and she hosts an early dementia choir. And so it's a choir that's really good, and anyone's welcome to join. But it's sort of an open door for folks with early onset dementia or early signs of dementia to join a choir. And it's just it's such I've been able to sort of access it, and it's such a welcoming place. I think it's a great example of that cultural piece of, just this is, we all go through different things in our world, and it's okay. There's a place there's lots of places for support there. So thank you. I think that's we've got just a couple minutes and a few announcements. I do before we go, I do want to thank again Debbie Ho and Amy Lin, who are settlement workers with the ISS of BC. And I have to say that this kind of a shout out to ISS of BC. They've been such a great partner within the Primary Care Networks Working Group and in supporting the DOCTALKS. They're one of the main reasons, and Thea Fiddick who's our key contact, is one of the great drivers and supporters. So we really appreciate that. And Dave, just before we go, did you have any last words you wanted to mention?
Stay safe and stay sharp, and don't hesitate to call your family doctor if you have any concerns at all about your memory, your health, or your emotions. Your family doctor is there for you. You just need to give them a call.
Great. Thank you, and I do again want to thank. I mean, it's always a joy to work with Dr. Wong. I really it's mutual admiration, it seems, and I really appreciate that. It's just he's not only his knowledge, but his point of view is so valuable. I do want to just mention a couple things before we go. There will be another Doc Talk next week, which is about the flu vaccine, and it's not just about the clinics, but it's about what the things you need to think about before you get a vaccine, and also all of the options that you may have in terms of getting a vaccine. And obviously, from Dr. Henry, we're hearing that everybody should be getting a vaccine, and then when we go out to get a vaccine, we're being told we might have to wait until the end of November. Well, there are new and emerging options in Burnaby, not the least of which is call your family doctor, because very often that's the first and easiest place to get a vaccine, but there are also other options. So we'll have Dr. Valdez-Sangera to speak to you then, and also possibly some folks from Fraser Health, and you'll come away with a really clear understanding of what the options are and why you should get it done. Manny, maybe you can move to that last slide for me, would be great. One more with some. That's it. So these are some of the different resources that we've talked about. Again, we will email out this whole presentation, so you'll have all of Dr. Wong's slides as well as these slides. I do want to mention the BurnabyCoronavirus.com website, which isn't on here, but it is the host website for the coronavirus.com, and it does have all of the Doc Talks. And if you haven't seen others, you may find that many of them are that some of them will be of interest to you. So, we do have more coming forward. Again, we have some in the in this one. We're doing a translation that I hope was successful. We were excited to be able to do it with Debbie and Amy, and our anticipation is that we'll be looking at different translation into different languages as we go forward. So I want to thank everybody for coming as an audience. Again, if there are questions that you have after this and you wanted to email them or return by email, we'll do our best to answer them. Please take a look at the website, and as Dr. Wong said, stay safe, be careful, be kind, and we'll look forward to seeing you online soon.